بسم الله الرحمن الرحيم. السلام عليكم. I am Professor Adam Ahmad Adam. You are welcome to this parasitology lecture. It is about malaria part 2. We talk in this part about pathogenesis and pathology of malaria. Pathogenesis is a mechanism of disease occurrence, and pathology is a resulting disease. At the end of full maturation of senescent stage, the infected red blood cells rupture, releasing merozoites and hemozoin. Hemozoin induces pyrogens, which are fever-inducing substances. These are tumor necrosis factor, macrophage, inflammatory protein 1 alpha, and macrophage inflammatory protein 1 beta. They induce symptoms and signs of malaria, like fever, chills, nausea, vomiting, joint pain, and so on. There will be hemolysis of red blood cells, infected and uninfected. This leads to hemolytic anemia. Cytoadhesion of the red blood cells will lead to vasoocclusion, ending up into tissue and organ ischemia. This is found in falciparum malaria. It is mediated by Plasmodium falciparum erythrocyte membrane protein 1. The infected red blood cells become sticky and adhere to endothelial cells of organs deep microvasculature. So they stuck and obstruct the microcirculation in the organs, the deep microcirculation in the organs, leading to their ischemia. Blood vessels are blocked, causing tissue ischemia. There will be increased vascular permeability, leading to extravasation of fluid from the intravascular compartment into interstitial compartment, causing edema, and this edema may be in the lungs or the brain. Hepatosplenomegaly, increase in size of liver and spleen. This is due to hyperplasia. Hyperplasia is increase in organ size due to increase in number of its cells. Here we talk about some terms. Pre-patent period. This is the period from the time of infection to the time of parasite demonstration in the lung. Incubation period. This is the period from the time of infection to the time of appearance of the clinical manifestations. And here is a table that shows the pre-patent period and the incubation period for the Plasmodium species. What is the fate of untreated malaria? If malaria is not medically treated, what will happen? There are three possibilities. One, termination of the disease. The immunity of the patient will get rid of the disease and the patient becomes well. Two, chronic malaria. And here malaria will be in the patient for quite a long time. Three, death if the malaria is severe. Recurrence of malaria. That to say, malaria is back after clinical cure without external infection. Malaria will come without infection from outside. There are two types. one recrudescence. And this is caused by Plasmodium falciparum and Plasmodium malariae asexual erythrocytic stages. If the patient has malaria from these species, the asexual erythrocytic stages will cause the clinical malaria. And if the patient is cured clinically, there may be a small number which are unable to cause clinical malaria or be demonstrated in the lab. After some time, they may multiply and reach a stage where they can cause clinical malaria to relapse. And this occurs by Plasmodium vivax and Plasmodium ovale hypnozoites in the liver, the sleeping stages in the liver. Complications of malaria. Acute complications. These are caused by falciparum malaria, commonly in non-immune people. They are life-threatening conditions. So if the patient is not properly treated, he or she may die. These are cerebral malaria, and it is due to cytoadhesion and cerebral edema. Algid malaria, and here the patient will be in a state of circulatory collapse. Black water fever, this is due to massive hemolysis of red blood cells. Choleric malaria, the patient will have cholera-like diarrhea. Pulmonary edema, and here the condition will be very grave. Hypoglycemia, the glucose level in the blood will be quite low. During pregnancy, there may be miscarriage, premature delivery, stillbirth, born full-time but dead, small for death, newborn, that to say the pregnancy may be full-time, but the baby will be of a small size, and congenital malaria. Chronic complications caused by all species, splenomegaly, hepatomegaly, anemia, and growth retardation. Growth retardation, this is common in children. The growth of the child will not match his or her chronological age. By this, part 2 is over. I hope that it is understandable. Please proceed to part 2, and I wish you all the best.